Welcome back. We'll start a look at the regulation of the heart and the inner workings of the heart's physiology itself. So, as the heart is contracting, its sole job is to pump blood out to the rest of the body. And as it does so, this gives us a amount of blood that can be done so in any given period of time. So typically we measure this in minutes. And so how much blood is actually going out through the left ventricle in 1 minute, and that equals our cardiac output. And so our cardiac output is essentially every contraction that happens, add up each of those contractions, see how much blood actually comes out of the heart. The amount that is actually sent out of the heart is our stroke volume. So that's the actual amount that we have going out. And then multiply that by the heart rate. So heart rate times stroke volume is going to give us our cardiac output. And so if a typical heart rate is 75 beats per minute, multiply that by the amount of blood that is ejected from the heart with each contraction, roughly being 70 milliliters, we're going to come up with a cardiac output that is just over 5 liters a minute. And that number should be familiar, as that's going to also be generally the approximate amount of blood volume that we have. And so just about every minute, the entire blood volume of the body is going through the heart. That doesn't mean that all of the blood is going through the heart, but at least the entire volume of it is. Depending upon what we're doing and depending upon who we are is going to dictate what our cardiac output is. And so that cardiac output is going to, since it is stroke volume times heart rate, so stroke volume times heart rate equals our cardiac output. If our stroke volume is going to change because we either have a smaller heart in the case of an infant, or if we have a larger heart in the case of an adult, that means that the amount of blood that can be contracted with each beat is going to be either smaller or larger. And so in the case of an infant, they're going to have a decreased stroke volume, and in an adult, comparatively, they're going to have an increased stroke volume. And so in order to have essentially the same kind of cardiac output in terms of the overall coverage for the body, that's going to lead to having to have a heart rate that is increased or a heart rate that is decreased. And so we want to maintain that kind of general output that is there for the body itself. And so we're just going to alter that based upon how much blood is going through the heart at any given time, and that's going to dictate where our heart range is for our cardiac output. This can also determine, in terms of that stroke volume and cardiac output, can also be determined based upon heart rate as well. And so if a person's heart rate is a little bit lower, their stroke volume is potentially going to go up because they've got a longer period of time where their blood can be flowing and filling the ventricles. If their heart rate is up, they're going to have typically a decreased stroke volume. And so their heart is giving less time for blood to flow into those ventricles. And so that is potentially going to lead to a change in our cardiac output. But at the same time, if stroke volume has increased and heart rate has now decreased, this still may equal a normal cardiac output. Because if the stroke volume goes up enough and the heart rate goes down enough to compensate in a sense, we still may have a relatively normal cardiac output. It all depends. It all depends upon their then ability to contract that heart, because the more blood then that we have in there, the stronger the contraction is going to have to be in order to get that blood out of there if they have a decreased heart rate. So our cardiac output for rest is roughly 5 liters a minute. But that's for resting. That's for sitting around, not really doing a whole lot. Now, if we're going to go out and do some exercise and we're going to have physical exertion, we're going to need to be able to increase that cardiac output to accommodate the needs of our muscles. And so our increased needs of the muscles in terms of glucose and oxygen means that cardiac output has to go up. And so if an exercising adult gets their heart rate up to 170 beats a minute, and has a stroke volume then of 100 milliliters, they're going to have a rough cardiac output of about 20 liters a minute. And so we've gone from 5 liters a minute up to 20 liters a minute. And so we have now 4 times the amount of output that we had. And that's going to help with supplying those muscles with all the blood supply that it needs. Get all of the oxygen there, get all of the glucose that it needs in order to have a normal functioning of those cells, and thereby decrease fatigue. We talked before about the pacing of the heart, and so we determined that the SA node is the place where we're going to determine how quickly the heart is beating. So our heart rate is determined by that SA node there. But that's not the only thing. We know that although the heart is autorhythmic, it has its ability to contract on its own, it also is influenced by the autonomic nervous system as well as hormones. And so we can have both the autonomic nervous system either decrease heart rate or increase heart rate at any given moment, and hormones can do the same thing. And so depending upon what the overall needs of the body are at that period of time are going to then kind of override what the heart wants to do at any given moment at times. So the autonomic nervous system, so our parasympathetics and our sympathetics, are going to have different effects on the heart itself. Most of the time we're going to be in this parasympathetic state, and so most of the time the parasympathetic activity is going to want to try and decrease heart rate, and so the SA node is going to be inhibited in some way. The parasympathetic system does this by releasing acetylcholine, and so we get ACH being released out onto the heart itself, and it goes and finds muscarinic receptors, and those muscarinic receptors are then going to lead to a decrease in heart rate. But if all of a sudden we're excited and things are going on, things are happening, the sympathetic nervous system can then release our norepinephrine, and norepinephrine is going to go find our beta-1 receptors, and on those beta-1 receptors we're then going to get a stimulating effect. So heart rate is then going to go up. And so these changes can occur within the body at any given moment, depending upon what is actually happening with the body itself. Parasympathetic stimulation, we saw before, is going to have the effects not just on the heart, but elsewhere in the body as well. And so it's going to inhibit stimulation to the SA node. And so it's going to have an inhibiting effect on the SA node itself. And so as that occurs, that slows down that SA node firing, which then increases our AV node delay. So that period of time where the ventricles are filling. And with that, we get a weaker contraction of the atria. And so we're not going to push as much blood into or force as much blood into the ventricles from the atria themselves. They're going to simply follow their pressure gradient and move from the atria into the ventricles following that gradient that's there. When the sympathetics kick in, now they're going to have a positive effect. They're going to be stimulating to that SA node. That's going to then decrease the time of the AV node delay. So we're going to decrease that. Now we're going to have less time in between contractions. This allows for a change in the conduction velocity so that we have an increase in action potential throughput through the bundle of His and the Purkinje fibers. This then leads to an increased strength of contraction in the ventricles as well as in the atria. So now we're going to basically be forcing more and more blood from the atrium into the ventricles. So that's going to increase our stroke volume as well as increasing our heart rate, which then leads to an increased cardiac output. So now we have the ability to keep up with the needs of the muscle at that time, and we're able to make those changes that are going on within the heart itself. And then we can start to look at the additional changes that occur in the heart as we continue to exert ourselves next time.